Next, I think is one person is absent. So we have Dr. Aparna. She's going to speak on microbiology and antibiotic susceptibility pattern in CNLDO.
Very good morning to one and all. I am Dr. Aparna KS and my topic is microbiology and antibiotic susceptibility pattern in children with congenital
I think the slides are not running.
duct obstruction.
Yeah, दिख नहीं रही ना. Slides check कर दीजिए या run नहीं कर रही है. अब हो गया.
CNLDO is one of the major causes of epiphora in children. The impotency can lead to stagnation of tears in the lacrimal sac, predisposing to microbial growth. The microbiology profile and antibiotic sensitivity patterns keep changing with time, region and preferred practices. So it is prudent to know the current sensitivity pattern to guide the empirical choice. In this background, aims and objectives of my study are to analyze the microbiological spectrum and antibiotic sensitivity in children with CNLDO and to determine appropriate antimicrobial agents. This is a prospective comparative study done in a tertiary eye care center in South India. We included 198 eyes of 170 children in the age group of 0 to 5 years with CNLDO. We included children during their first visit who are droplet positive and excluded already treated cases of CNLDO. About 30 children in the same age group with other ocular complaints were included as control group. After detailed history taking and comprehensive clinical examination, microbial samples were collected by applying pressure over the sac area and the discharge was sent for bacterial and fungal examination using culture-based techniques. Antibiotic susceptibility was tested using Kirby-Brewer disc diffusion method for the panel of drugs commonly used in our population. Statistical analysis was done. Coming to the results and discussion, out of 198 eyes, we had a slight male predominance compared to previous studies. 84% children had unilateral involvement with comparable involvement of right and left eye. In our study, no growth of organisms were observed in 5% of cases and 11% had a polymicrobial growth. And we had a slight gram-positive predominance, which is about 48%. And negative culture in our study is very low compared to previous studies, maybe because we excluded the previously treated cases. And the fact that not all discharges are infective must be kept in mind when a decision to start antibiotics arises. Distribution of gram-positive and negative isolates are highly variable in previous studies, and we had comparable result to Ushaki et al. Study done in 2006. Another recent South Indian study by Muthumalai et al. Showed a higher involvement of gram-positive organisms. In our study, the most common gram-positive isolates are Streptococcus pneumoniae followed by viridians, and most common negative organisms are Haemophilus followed by E. coli. And in Muthumalai et al. Study, Staphylococcus epidermidis was the most common isolate, maybe because of the frequent use of antibiotics changed the flora towards the Staphylococcus epidermidis. Among the control group, 80% were either culture negative or had only mild growth of Staphylococcus epidermidis. Coming to the sensitivity pattern, for gram-positive organisms, it was highest for chloramphenicol followed by vancomycin, and for gram-negative organisms for aminoglycosides. But both group of organisms showed comparable and reasonably higher sensitivity for fluoroquinolones. And coming to the resistance pattern, for gram-positive organisms, it was highest for aminoglycosides including tobramycin, and for gram-negative organisms, it was highest for cephalosporins. Mann-Whitney U-test showed there is no significant difference in the sensitivity pattern of both group of organisms for ciprofloxacin, ofloxacin and garifloxacin. Tobramycin is the most commonly prescribed antibiotic in pediatric age group, showed higher resistance, maybe because of the indiscriminate use. And in 2011, American Academy of Pediatrics approved topical fluoroquinolone for treatment of bacterial conjunctivitis, and they told it is well tolerated. So our study shows that both moxifloxacin and garifloxacin have a better sensitivity profile compared to ofloxacin, but we would like to recommend the use of ofloxacin as the empirical drug of choice in CNLDO because of its reasonable efficacy and lower cost. So to conclude, presence of pathogenic microorganisms is common in CNLDO, and investigating the microbial profile is essential. Both gram-positive and gram-negative microorganisms were isolated in our study, and with a slight predominance of the gram-positive organisms. Streptococcus pneumoniae was the commonest organism isolated, and fluoroquinolones are the effective antibiotic for children with CNLDO because of its coverage of both group of organisms. And I don't have any financial disclosure. These are my references. Thank you.
Good presentation. Doctor, many times the patients come after using the antibiotics. In those cases, what you did?
Actually, in our study, we didn't take the previously treated cases. We excluded the previously treated cases and we included only the first presentation only.
Means most of the time they have already used it.
Yeah, most of
They
the
are
time.
means you can always include them.
Exclusion criteria.
You can take them, but there will be a gap.
Yeah, at least 4 weeks should be there, but for the purpose of study, I took like that. And this study is done in a rural area in South India.
Okay.
So most of the patients
Okay.
are coming after the age of 1 year, even though the presentation is early. In my study, most
Okay.
of the children came at the age of
Okay,
after
okay,
the
got
age
it.
of 1 year.
Any uncommon pathogens you came across?
No, madam. No, most of the pathogens were common organisms only we isolated, and no
Okay.
fungal isolates also.
Okay, thank you.
You recommend that we should stop advising Tobra, which is we are doing so
Yes,
casually.
madam. That is why I started the study, because most of the prescriptions coming to me is they are using tobramycin, whatever it is, conjunctivitis, even for viral infection also. If it is pediatric population, most of the ophthalmologists are using tobramycin, and it is now it is showing resistance, maybe because of the indiscriminate use, and it has a intrinsic efficacy towards the gram negative spectra, and most of the pathogenic organisms are gram positive. So I strongly suggest this fluoroquinolones we have to start in children. That is approved by American Academy of Pediatrics also.
But in younger group, they say you should not prescribe fluoroquinolone.
Nowadays, they say aplastic anemia is not there due to that.
Newer guidelines suggest, like
Newer
even in
guidelines.
2011, AAP guidelines suggest that we can use, even for pediatric children after cataract surgery or any other surgeries, we are using moxifloxacin and all. So we can use it for this also. That will be better than using a drug which is not at all useful for a disease.
Thank you.
It will
Let's have few more studies before we change. Thank you.